I welcome you to Menstrual Advantage Therapy, MAT. This is a holistic brand for female health, so we naturally handle everything female from the top of your head to the sole of your feet, from menstrual cramps to endometriosis, ovarian cysts, fibroids, adenomyosis, PCOS, irregular periods, excessive bleeding, infection like itchy sensation caused by fungi, smelling vagina caused by bacterial vaginosis, and all vagina and breast related issues like fibroadenomas, Bartholin cyst around your vulva, and lots more. I can't exhaust everything in one class, it will take hours. So let's see what you can learn in the next few minutes. Some of you are returning students from 2022, 2021, 2020, or previous years, so you already know me. But if you're new here, my name is Clinton Itoto, your dynamic health therapist and world first menstrual therapist. You can follow me on Instagram and Twitter at Clinton Itoto to get daily updates on female health. I have thousands of ladies on WhatsApp I teach daily on how to end uterine, breast, and vaginal issues naturally without drugs, herbs, products, supplements, or all those unnecessary things you have wasted money on. Over the years, I've been able to help women get pregnant, ladies get more wet and slimy and juicy vagina, and also help some lose weight and others to gain weight. Basically, everything female health can be handled naturally. What if I told you that you have been lied to all your years on earth that menstrual cramps are natural? You get words like, it's because you're still a virgin, that is why you're experiencing cramps, or don't worry, when you start giving birth, it will all go away. That's a lie. Menstrual cramps are not natural. Be patient and watch the class till the end, as I will tell you everything about menstrual cramps, alright? Some ladies experience nipple discharge even without being pregnant or done an abortion before. Nipple discharge is caused by high levels of prolactin, while breast pain can be caused by hormonal imbalance, fibroadenomas, and lots more. More than 80% of ladies don't understand what hormonal imbalance is. So you won't be patient enough, but I would have explained it. But scroll down my Instagram page, you will see where I explained what hormonal imbalance is. Let's begin with infection and vaginal issues. Most ladies experience reoccurring infection even after they have spent a lot of money on drugs and different methods to end it. Infection like Staphylococcus aureus, yeast infection, itchy sensation and creamy discharge from the vagina, swollen vulva, rashes, blisters, smelling vagina, and lots more. Most of you don't know that the more drugs you take, the more damage you cause. Yeast infection and Staphylococcus aureus are not sexually transmitted infection, but can also be gotten through unclean and unsafe sex. All right. Now they can build up from toilets, that's unhygienic toilets, obviously, and wearing very tight non-cotton pants, drying your pants in the bathroom. From you can also get it from toilets, tables, your phone, that's the back of your phone, doorknobs, and many more. All right. So just be patient and learn. I'll definitely teach you how to take care of your pants and others. So let's touch a little bit of menstrual issues. All right. So, why do you experience cramps and other irregularities? The uterus is a muscle, and before your ovulation, the uterus builds a blood like clothing within the uterine wall called endometrium. Days after your ovulation, when you don't get pregnant, the endometrial tissue begins to shred off gradually from the uterus in form of blood, which is now known as menstruation. You go through excruciating pains of high buildup of hormones in your system called prostaglandins. This is what causes pains, uterine contraction, mood swings, vomiting, pain in the thighs, legs, restlessness, bloating, and lots more. All right. This can also be caused by underlying uterine issues like fibroids, endometriosis, adenomyosis, ovarian cysts, and others I mentioned earlier. More than 60% of ladies have uterine issues but are ignorant of it. This is why I advise all my students of MAT to go for pelvic scan at least once a year and then send me the results to give them detailed explanation. So you know it is not the egg or ovum that comes out in form of blood every month. It is the endometrial tissue. The egg after ovulation shreds off, and thereafter, based on calculation, you can have unprotected sex for some specific days without getting pregnant. All right. This is for those that like it raw. Yes, you can avoid abortion and getting pregnant without taking contraceptives and pills that would cause you pains and irregular periods. I'll teach you that privately if you want, And at the end of this class, you can send me a DM on WhatsApp to get the knowledge for perfect period calculation instead of using apps that fail you and apps that don't know your body better than you do. Also, I'll teach you how to get very wet and slimy vagina during sex if you experience dryness and painful sex or no pleasure at all, right? And so, those with fibroids, endometriosis, ovarian cysts, and others have been told that the only solution to this is surgery. That's not true. Let me explain. Fibroids are tumors that grow as a result of different hormonal and estrogen changes. Fibroids grow bigger based on different food substances and drugs, while endometriosis is the tissue of the endometrium, which is supposed to form within the uterus, now begins to form outside the uterus. In the case where they form within the uterine wall, it is called adenomyosis. So let's get the difference. Endometrium is naturally formed inside the uterus before ovulation, while endometriosis and adenomyosis are uterine issues, all right? So there is inside the uterus, within the uterus, and outside the uterus. I hope we understand. Fibroids, endometriosis, adenomyosis, endometrial hyperplasia causes excessive bleeding and inability to conceive. Also, it can cause miscarriage and many more, right? Now, for ovarian cyst, this is a sac filled with fluids attached to the ovaries, while PCOS, polycystic ovarian syndrome, means that you have many cysts or sac of fluid within the ovaries, and this can cause absence of menstruation, short and light menstruation, overweight, hair growth in unwanted regions of the body, infertility, and yes, I've seen ladies that went for years without seeing their periods. So that's before they met me, and it's called amenorrhea. Many of you have been told that it is just sugar that causes cramps and other issues, but this is not totally true. Benzoates in some foods, atrazines, glutens, high fructose corn syrup, and many more can cause pains, hormonal and breast issues. The funny thing is, even if you stop taking those beautiful poisons, you'll still experience these issues that you're already experiencing, all right? So you're expected to now cleanse and re-engineer your body to help it heal naturally and reduce prostaglandins and other toxins. Then balance your hormones, and then you can become whole again. Don't worry, I don't sell drugs, herbs, or supplements, all right? All I'll teach you are natural, simple ways to handle them, because drugs are gradually killing you. And then there are looming future complications as high as infertility. More than 70% of my students had ulcer before they met me, and due to the intake of Felvine, ibuprofen, and other pain relieving drugs called NSAIDs, which are non-steroidal anti-inflammatory drugs, right? Some of you would say, I have friends and family that don't experience cramps at all. So please note, there are 4 categories of different body types called CAFE. Note it, CAFE, C-A-F-E, C-A-F-E. Listen, now the C are the commandos. Those your friends that don't experience cramps, no matter what they eat or ingest, it's like they were born differently. All right. While the A's are the all hell loose set. All hell loose. They experience excruciating pains during periods and also vomiting, leg pains, breast pains, and lots more. Abdominal pains, and even some get rushed to the hospital. As long as you experience pain at all, you are in this group. And then the next are the February 29th category. Because of the inconsistencies in their flow days, we have 2 groups here. Those that experience irregular periods with no cramps at all, and those that experience irregular periods with cramps. Some ladies experience scanty periods or short periods. Some even experience longer days of periods. Menstruation of just 2 days is not normal, all right? So as menstruating for more than 7 days. Some ladies even have blocked cervix, all right? Now, the last set are the evolvers. These ladies were experiencing a cramp-free life until their village people with strong powers from their father's side decided to table their matter. So actually, they started experiencing cramps and irregularities from exposure to the things I mentioned earlier. I repeat, drugs are gradually killing you. I would have continued, but many are impatient to know that even folic acid increases the size of fibroids. Yes. So you that is taking folic acid and haven't done any pelvic scan, well done. And also, some ladies have blocked fallopian tubes caused by 2 major things, hydrosalpines and salpingitis. Now, salpingitis can make you experience ectopic pregnancy, while hydrosalpines can prevent you from even getting pregnant at all. So now you have an assignment that you have to do. Now, go for a pelvic scan in any standard lab. I'm not saying, oh, come to my hospital or come to my lab. No, I'm not telling you that. Go to any standard lab. Tell them you want to do a pelvic scan. Once you're done, send me the results on WhatsApp and I'll explain to you. Or better still, you can even take it to your doctor to explain to you. And then your next assignment, do an intensive research on how fibroids grow and why is it that 70% of the time fibroids regrow within 3 to 5 years after surgical removal of the fibroid, which is myomectomy. So why is there a 70% chance of regrowth within the first 3 to 5 years of surgical removal of fibroids? So that's an assignment you have to do. There are lots of issues I can't really teach here because the class will be too long. I didn't mention things like herpes, UTIs, vaginismus, pelvic inflammatory disease, hemorrhagic cyst, dermoid cyst, gastritis, chlamydia, mastitis, uterine prolapses. There are many more, all right? But then some of you will still come to my DM and say, sir, you didn't mention my issue. How am I sure that you can help me handle it? Now, I didn't mention those things because I can't mention everything here. It doesn't mean that I don't know what's wrong and I don't know the solution for it, all right? It doesn't mean that. Now you have two options. You can either go with what I've told you already and what you have learned here today, or let me take you by the hand on a step-by-step process on how to end your frustration, intake of drugs, hospital bills, pains, lots of pains, and then loss of hope, missed classes, important business meetings and events, embarrassment, inability to ovulate or conceive, and lots more. To be a woman is not easy. Now, natural solutions to all this can be learned in MAT Masterclass. Do you know that a pregnant woman cannot drink Zobo? I believe you didn't know before that. Zobo drink can cause miscarriage. So these are lots of other things you can learn in MAT Masterclass and solutions to different problems. So, what will you be learning in the masterclass? Number one, we have natural ways to end menstrual cramps, vaginal and uterine issues naturally. And then we have how to lose weight and also gain weight naturally. Yes, some people want to gain weight. And then how to handle infection, smelly vagina, have a very wet, slimy and sweet vagina for those that experience vaginal dryness and pains during sex. And then we have natural ways to end excessive bleeding and abortion healing process. Yes, there are some ladies that did abortion and the healing process is not going fine or didn't go fine. So you can do that or actually naturally. And then how to handle breast pains, bedwetting and frequent urination, how to prevent and treat yeast infection, PID and UTIs, how to generally stay healthy without visiting the hospital frequently, and how to glow and have shiny skin, all right?
Menstrual Advantage Therapy is a therapy that I can recommend for anyone that would love to be relieved of the monthly cycle pains on monthly basis. I took the class and I do not regret taking the therapy. You will not only feel it in it eradicating the pain, but you will feel it even in your general well-being, because I feel it in my body, I feel it in my system. I feel that I feel much more lighter and I feel much more good on daily basis. So Menstrual Advantage Therapy, it works. It works. It works. And I can say it again, it works.
Before I joined MAT, I had enlarged ovaries, but 2-3 months down the line, I went back to the hospital to run a scan, and guess what? My ovaries are normal, nothing like enlarged ovaries. MAT is real. It is a no scam zone. Trust me. MAT is real.
Before I attend the masterclass, I always, every time, I always experience a lot of pain. A lot of pain. Rolling on the floor, stooling, vomiting, stomach ache, headache. The cramps are just so mad. But after the class, I can tell you right now that I'm cramps free. Like cramps free. I don't have to go to the hospital anymore. I don't have to take pills. I don't have to take any herbs. I'm free. I can say it and I can say it again that MAT works.
Usually I have really mad cramps on the first day that I have to, but I'm really normal. I was able to walk around, have my bath, cool, and then I look very relaxed. And I even reduced moderately than the way I was all big and stuff. Yeah, this is that. It really worked.
I I used to have horrible cramps. It was so severe. And everybody I went to, even doctors and nurses, told me it's just a phase, it'll pass. It's just a phase, it'll pass. And as God would have it, I found MAT on Instagram, just going through my Instagram page. One morning I was having severe cramps and I found them, and here I am. I can be on my period and be jumping around. Like, that wasn't even me. People are surprised. Like, people have seen, like, people that know me have even testified. So join MAT to do. Cramps is not about drugs. I took drugs and I swallowed pills and it kept coming back. So join MAT today. MAT works.
Hi everyone, my name is Benita and I'm here to share my testimony of how MAT have really been a lifesaver for me. Right before MAT class, I literally roll on the floor for pain. Like, I could be in pain for, like, say, 1 whole week of my period. But when I came across MAT class, I can tell you I no longer experience cramps. I'm now cramps free. Like, I don't think about the period anymore. So cramps are not natural. And I'm loving my body since after MAT class. So yeah, MAT works.